Hey guys, it's the 27th of May. Ava, will you step up, please? Go away. Step up. Step up. Thank you. Thank you. Oh my goodness. It's white under my feet. It's white under my feet. Really silly girl. Anyway, this is Miss Ava. Ava is an 8-year-old Appaloosa cross. Because she's Cremello, I have to assume that she's quarter horse cross. So she's a Cremello Appaloosa. And we're giving her a bath this morning because she's getting ready to go to K-State. Hi, what is the matter with you? Huh? How many baths have you had? Yeah, but it's scary. Look at all that white stuff under my feet. Go ahead and scrub the other side, please. She has something developing in her eye, her right eye, and we're getting ready to take her into the ophthalmologist at K-State and have it figured out. You know, those breeders out there that put together Appaloosas and quarter horses and Cremello quarter horses with Appaloosa coat colors, you know, it just potentially sets horses up for problems. And she has had vision issues since she was born, genetic likely, or at least congenital for sure. So she is not blind, but she does have some issues, and whatever it is that is developing in her right eye is likely going to cause her more sight issues. So she is getting ready to go in, and in the process of getting her to go, since we've had so much mud over the last few days, she's getting a bath so she doesn't look like an abandoned or an orphan horse, an abandoned horse. So we're getting that done this morning before we take her in. Taking the winter colors out of her tail. She is Cremello, so she'll never be white. She'll always be this beautiful cream color, but she gets as dirty. Yeah, it's just as dirty as the white ones do, don't you? The ones that are actually gray. Yeah, babe. I know. That feels good, doesn't it? And yes, we have to get this intimate with our horses to help clean up parts of their body that get dirty just like a baby's butt. And under, between her legs, and clean her udder. No, she doesn't need this for her trip to the vet, but since I'm doing it, I'm gonna do it for her pretty close to all the way. Oh yeah, your udder is dirty. Your udder is dirty. Yes, it is. Oh, good girl. Good girl, thank you. What a good girl. So their udder has to be clean between their two teats in order for them to have comfort there as well. Just like we would like to have comfort in certain parts of our body. A little more soap in there. Hey, babe. David, would you be able to turn the water off and change this off into the sprayer, please? The green sprayer I've got there to rinse. Thank you. Yeah. Well, I feel a little bit of a fatty tumor in her right teat. That's new, at least since her last bath. So I don't know how long that's been in place. We just went to Denver to retrieve her from a potentially difficult situation. And this particular tumor may have been in there for the years that she was gone with that particular person. So we'll have to have that looked at today too. Just to at least have him give us an initial impression. Well, we're here at K-State. Ava is being very good at her initial evaluations and getting ready to sedate her so we can look more closely and see if we can determine what's going on with her eyes. Being a good girl, despite all the background noise. Time for a little sedation. Thank you. That's our freeze brand for our organization. Oh, it's so cute.
she's got this sort of ulcerative lesion there. So compared to her entire eyelid, a little bit erythemic there, but then here, a little bit of an ulcerative lesion. She's got a little bit of mucoid discharge from this eye. Very thin iris tissue. You can almost see her pupillary reflection through it. She has some iris hypoplasia. And her retroposterior globes, I'm just lifting her upper eyelid and then pressing on her globe, and that brings the third eyelid forward. She's got, again, some kind of mucoid discharge on this side. Some blood vessels coming from the limbus. Most of the way around. On this side again, she has some iris hypoplasia. We're also going to talk too about it too. All right.
But sometimes impressions present themselves during an exam that don't come out during a discussion.
Okay. So again, her eyelid on this side, she's got some areas that are redder than others. She has some blood vessels kind of growing into her cornea over the majority, kind of right at the edge. She has some iris hypoplasia, which is just under development of the iris tissue.
So would you describe the vessels growing in as a nevus and maybe as a result of an injury, or what would be your initial thought about that particular tissue that's grown across?
Oh, this portion of tissue here, these blood vessels. So I think that, again, this kind of raised pink to white appearing tissue, my top differential would be squamous cell carcinoma.
Okay. That was the initial one. So I didn't know when you said blood vessels, I thought, maybe it's a nevus.
She has some much smaller blood vessels kind of around the outer edges of her cornea. I don't know that this is raised enough for us to be able to get a biopsy today. I'll have Dr. Rankin, our ophthalmologist, take a look and see. So then moving to...
Love giving the K-State students the opportunity to learn. I consider Rainbow Meadows a teaching tool for the students, especially when they come out to the rescue and get to see a lot of different animals and a lot of different concerns or conditions. So this just happens to be in the hospital visit.
Okay, so you see the blue eye. And Dr. Cullen, I agree with you, the corporate eye are beautiful. And your pupils coming down too much. Just to get a good view. I think what we'll do is give you some more time to evaluate, and then we'll come back.
I think I'm good. Okay.